Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Thank you for coming in today. I see you've had quite a few challenges with your pain recently. Can you tell me a bit more about what you've been experiencing?
Well, doctor, it's been tough. The pain starts right above my right hip, and it feels like a hot ribbon going down my leg to the calf and up through my neck to the base of my skull. It's been getting worse over the last few months. I used to manage with Tylenol at night, but it's not enough anymore. The pain interrupts my sleep and makes it difficult to get through the day.
I see, and how did this start? Was there an incident or did it come on gradually?
It's hard to say exactly when it started because it was gradual, but it definitely got worse post-transient ischemic attack in October. That's when I noticed the pain becoming more constant and sharp.
You mentioned a visit to the emergency room a month and a half ago. What happened there?
That was a rough day. The pain was unbearable, so I went to the ER hoping for some relief. Unfortunately, they didn't do much. They just sent me home with advice to follow up with my primary care doctor. I felt like they didn't understand how severe the pain was.
That must have been frustrating. Have you been able to follow up on any of the recommendations from the ER?
Somewhat, yes. I was advised to see a physical therapist and a social worker about my VA coverage, but I've had trouble scheduling appointments. It's all just been overwhelming, and with the pain, it's hard to stay on top of everything.
Understandable. Have you started any new treatments or changes in medication since then?
My doctor prescribed tramadol for the pain, and we switched from Plavix to baby aspirin because I couldn't get a renewal for Plavix. I've also run out of diclofenac, which helped a bit more than Tylenol. I'm supposed to monitor my cholesterol with pravastatin, but with everything else going on, it's been a lot to manage.
Let's talk about your current state of health beyond the pain. How have you been managing your daily activities and overall well-being?
It's been a struggle. I can do most things on my own, but the pain limits how much I can move around. I can't stand or walk for long periods, which makes it hard to get out of the house or even do simple chores. My emotional state isn't great either. I've been feeling more depressed with all the pain and the difficulties it brings.
Thank you for sharing that. It helps me understand the full scope of what you're dealing with. Let's discuss your current medication. You mentioned running out. How has that affected your pain management?
It's been tougher without it. The Tylenol doesn't quite cut it, and even with the tramadol, I still have a lot of pain. I feel like I'm just barely getting by.
I see. Let's go over your lab results and see if we need to adjust anything in your treatment plan. Your liver and kidney functions are within normal limits, which is good. However, your fasting glucose and HbA1c are a bit elevated, which we'll need to keep an eye on. Your cholesterol levels are slightly above the target, so continuing pravastatin is important.
I understand. What are the next steps then?
First, we'll renew your prescription to help manage the pain more effectively. I'll also arrange a follow-up with the physical therapist to help improve your mobility and manage pain. We need to keep monitoring your cholesterol and glucose levels closely, so sticking with your medication and diet is crucial.
And the tramadol?
We'll continue with tramadol since it seems to be somewhat effective. I'd like to see how you do with the renewed diclofenac and physical therapy. Also, I'm going to refer you to an ophthalmologist to monitor the pressure in your eyes since we're not renewing the timolol. It's important to keep your overall health in focus while we manage these pain issues.
Thank you, doctor. I appreciate your help in managing all this.
You're welcome. We'll schedule a follow-up in 3 months, but please contact me if your symptoms worsen or you have any concerns in the meantime. Our goal is to improve your quality of life and manage your pain effectively.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've come back because the shoulder pain just isn't letting up. It's been months now, and while the cortisone shots provide some relief, it's temporary. I can barely lift my arm some days, and it's affecting my ability to work and stay active.
I see. Tell me more about when this pain first started and what exactly you feel.
It started a few years ago, but has gotten much worse over the past 6 months. The pain is mostly around my shoulder, but it radiates down to my arm too. It's a sharp pain whenever I try to lift something, or even just when moving my arm in certain ways. We thought it was the rotator cuff initially, didn't we? I've had shots every 3 months, but it seems like we're missing something.
Yes, we've been managing it as a possible rotator cuff issue based on your symptoms. Have you noticed any changes in the pain or its pattern since your last visit?
Well, it's more of the same, but I feel it's becoming more constant. Also, I stopped the pravastatin as we discussed last time because I thought it was contributing to the pain. I noticed a slight improvement, but it's hard to tell if it's just from stopping the medication or the last shot I had.
Understood. You also mentioned attempts at quitting smoking. How is that going?
That's another battle. I've been using nicotine gum as we discussed, but it's tough. I'm considering the patches next. I've been smoking for almost 50 years, so it's not easy.
I can imagine it's quite challenging. What about the tests we did last time? Any new concerns there?
You know, the MRI threw me for a loop. It turned out the symptoms that we thought might be a stroke were just sinus infection and enlarged blood vessel. But getting into that machine with my claustrophobia wasn't easy. I'm really hesitant to go through that again unless absolutely necessary.
I understand that. We'll consider all possible options before recommending another MRI. Regarding your sinus issues, has there been any improvement?
It's the same old story. Constant postnasal drip, which my father had too. It's annoying more than anything. but I'm more worried about the shoulder and my general health with this cholesterol business.
All right, let's review everything today. First, we'll look at your shoulder more closely with some imaging, possibly an ultrasound this time, to see if we can pinpoint the issue without causing you discomfort. We'll also revisit your cholesterol management once we've settled the immediate concern with your shoulder pain.
Sounds like a plan. I just want to feel normal again, or at least be able to do my daily activities without this constant pain.
I completely understand your concerns, and I agree that we should take this step by step. Based on the history you've provided and the symptoms you are experiencing, let's summarize today's findings and discuss our next steps. Firstly, regarding your vital signs. Your blood pressure is stable at 130/85 mm/Hg. Your heart rate is normal at 78 beats per minute. Your respiratory rate is also normal at 16 breaths per minute. Your temperature is 98.6 degrees Fahrenheit, and your oxygen saturation is good at 97% on room air. Looking at your lab results, your complete blood count and kidney functions are within normal ranges, which is reassuring. Your liver function tests are also normal. However, your inflammatory markers, specifically CRP and ESR, are slightly elevated. This could be related to your shoulder pain or could indicate other inflammatory processes in your body. Regarding your cholesterol, the levels have slightly improved, but we still need to keep an eye on them and manage them appropriately. In terms of imaging, the chest X-ray showed the chronic effects of smoking, but fortunately, no acute issues. The X-ray of your shoulder revealed some degenerative changes, which are likely contributing to your pain. This aligns with the symptoms you've described. I recommend that you continue using the cessation aids for smoking and perhaps consider joining a support group for additional support in quitting smoking. I'd also like to start you on mild anti-inflammatory regimen to see if we can improve your symptoms, in addition to the physical therapy we discussed earlier. Let's plan to meet again in 6 weeks to review your progress. Of course, if you feel the need to come in sooner, or if there are any changes, please don't hesitate to contact the office. How does that sound?
That sounds thorough, Doctor. I appreciate your help in figuring this all out. Let's hope this plan makes a difference this time.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
We need to acknowledge that biases exist in healthcare settings. Addressing them starts with training staff on unconscious bias.
I agree, but training alone isn't enough. We should also implement standardized protocols that help minimize subjectivity in patient assessment.
Standardized protocols help, but they might overlook individual patient needs. How do we balance the two?
It's about creating adaptable protocols that account for diversity. Plus, involving patients in the design of these protocols could offer valuable insights.
Involving patients is crucial, yes. Perhaps regular feedback mechanisms could also help us track and address biases more effectively.
Absolutely, and continuous monitoring and training updates as societal norms and populations change. This is not a one-time fix, but an ongoing commitment.
That's true. Maybe adding a more robust review and feedback process for patients after their visits could help.
Yes, patient surveys can be part of the discharge process. Getting real-time feedback will allow us to quickly adjust and improve.
Also, having a diverse workforce can help. Ensuring that our team reflects the community we serve could naturally reduce biases.
Now look at question 26.
Managing myalgic encephalomyelitis can be challenging, but we'll find a strategy that works for you. How have you been feeling lately with your current treatment?
It's been tough, doctor. Some days are better than others, but fatigue often makes it hard to function.
I understand. We might consider adjusting your medication and integrating some physical therapy. It's gentle and can be tailored to your energy levels.
Does physical therapy help? I'm worried about overexerting myself.
It's a valid concern. The key is to start very slowly and adjust based on your response. We need to ensure you don't experience post-exertional malaise.
I appreciate that approach. Let's try and see how it goes. Can we also explore some dietary changes that might help?
Absolutely. A balanced diet can impact energy levels significantly. We'll work with a nutritionist to tailor a plan that suits your needs.
Now look at question 27.
When discussing postpartum complications, it's crucial to recognize both physical and psychological signs early. What are the key indicators you focus on?
The obvious physical signs like hemorrhaging are pivotal, but I also look for less obvious symptoms like persistent headaches or vision changes.
Good points. I emphasize monitoring for signs of postpartum depression as well, which can often be overlooked.
Absolutely. And let's not forget about monitoring urinary issues or infections. Postpartum care should be holistic.
Indeed, a multidisciplinary approach is essential. Early interventions can prevent severe complications. Regular follow-ups are key.
That's correct. We also need to educate families about these signs, so they can support the new mother effectively at home.
Yes, family education is a part of comprehensive postpartum care. The more informed they are, the better the support they can provide.
Now look at question 28.
With the recent heat waves, it's important to recognize signs of heat-related illnesses. Are you familiar with these signs?
Not really, no. What should I look out for?
Symptoms can include heavy sweating, weakness, cold, pale, and clammy skin, fast or weak pulse, and fainting. Staying hydrated and cool is crucial.
I sometimes work outside, so this is helpful. What should I do if I start feeling these symptoms?
Find a shaded or air-conditioned area immediately, drink water, and rest. If symptoms worsen or don't improve, seek medical attention promptly.
Thank you. I'll keep all this in mind when I'm working outside. How often should I take breaks?
At least every hour, take a short break in the shade and drink water. Also, try to wear light-colored and loose-fitting clothing.
Now look at question 29.
Today, I want to emphasize the critical importance of hydration in patient care. Dehydration can often complicate existing conditions and impair recovery. Ensuring adequate fluid intake should be a priority in our care protocols. For elderly patients, this is especially vital as they may have a diminished thirst response. Setting reminders for hydration can aid in preventing severe dehydration and the complications that arise from it. Let's all make a concerted effort to monitor and encourage fluid intake among our patients. We should consider integrating hydration protocols into our daily rounds and care plans.
Now look at question 30.
Chronic fatigue syndrome can be quite challenging to manage, but with the right approach, you can still maintain a quality life. Are you currently on any medication?
I'm not. I've been hesitant because I'm unsure about the options.
There are treatments that can help manage the symptoms, such as pain relievers and medications that help improve sleep quality. Also, dietary adjustments and gentle exercise are beneficial.
I'm open to trying these. How do I start?
Let's begin with a low-impact exercise plan and some basic dietary changes. I'll also provide you with some literature on these medications, and we can discuss further if you're interested.
That sounds like a plan. Thank you for the guidance. How frequently should we have these check-ins to monitor my progress?
We should meet every month initially. This will help us tweak your management plan as needed based on your feedback and any new symptoms.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Welcome everyone to today's healthcare webinar, focusing on the integration of technology in diabetes management. Joining us today is Professor James Laidlaw, an endocrinologist at the Royal Hospital and Professor of Medical Device Technology at the National University. Professor Laidlaw, thank you for joining us today.
Thank you, Esther. It's a pleasure to be here to discuss such a vital aspect of modern healthcare that is significantly improving patient outcomes.
To start, could you elaborate on why the integration of technology in diabetes management is particularly important at this time?
Certainly, Esther. The rapid advancement in technology, especially in the past decade, mirrors the requirements of complex chronic conditions like diabetes. Technologies like continuous glucose monitors, CGMs, and insulin pumps have transformed patient care by allowing more precise and continuous control over blood sugar levels. This is crucial because managing diabetes is not just about taking medication, but involves comprehensive lifestyle management, which technology now supports effectively.
That's fascinating. Could you share a case study that highlights these benefits?
Absolutely. Let's discuss the case of Sarah, a 28-year-old professional diagnosed with type 1 diabetes since she was 12. Sarah struggled with frequent episodes of hypoglycemia, particularly challenging at night. Despite rigorous self-monitoring, she faced difficulties maintaining glycemic control, affecting her quality of life and work. With the introduction of a CGM system, Sarah was able to monitor her glucose levels continuously. The CGM provided alerts if her glucose levels were trending too low or too high. This immediate feedback enabled her to adjust her insulin doses more accurately and preemptively, which significantly reduced her episodes of hypoglycemia. Furthermore, the data collected by her CGM could be shared with us, her healthcare team, in real time, allowing for more tailored treatment plans and quicker adjustments. Over 6 months, Sarah's HbA1c levels improved from 8.5% to 6.9%, and her incidence of severe hypoglycemia decreased dramatically.
That's an excellent example of how technology can personalize and enhance care. What are some of the challenges that patients may face when integrating such technology into their daily lives?
One of the main challenges is the overload of information. Patients like Sarah initially feel overwhelmed by the continuous data flow and alerts. It's crucial to provide adequate training and psychological support to help them integrate these tools into their lifestyle smoothly. Moreover, there's the aspect of accessibility and cost. Not all patients can afford these technologies, nor do they have the necessary support to utilize them effectively. As healthcare providers, we must advocate for broader access and ensure these transformative technologies benefit all segments of the population.
Given these challenges, how do you see the future of diabetes management evolving with technological advancements?
The future is very promising. We are moving towards more integrated systems where devices like CGMs and insulin pumps can communicate seamlessly, not only with each other, but also with other health devices and apps. This integration will provide a more holistic view of a patient's health. Additionally, we anticipate the use of artificial intelligence to predict and manage diabetes more proactively. AI could help us understand individual patterns in blood glucose levels and predict episodes of hyper or hypoglycemia before they happen. This could revolutionize diabetes care, making it more preventive rather than reactive. Finally, there's potential in the development of fully automated insulin delivery systems, or artificial pancreases, which could mimic the pancreas's glucose-regulating function more closely. This would be a significant breakthrough, reducing the burden of disease management on patients significantly.
Professor Laidlaw, thank you for such insightful discussion. It's clear that technology holds the key to transforming diabetes care, offering more precise, personalized, and proactive management options. We appreciate your time and expertise on this critical topic.
Thank you, Esther. It was a pleasure discussing these exciting advancements. Let's continue to push the boundaries of what's possible in diabetes care for better patient outcomes.
To our audience, thank you for joining us today. We hope this discussion has been enlightening and will inspire further exploration into how technology can enhance healthcare delivery. Goodbye for now and take care.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Welcome everyone to today's lecture on the integration of sex and gender in clinical research. Our discussion will delve into why this is pivotal, not just for achieving gender parity, but for enhancing the scientific accuracy and applicability of medical research. We'll explore these themes through a detailed case study involving cardiovascular disease, the leading cause of death globally. To begin, let's consider a Harvard Medical School study which highlighted significant differences in heart disease symptoms and outcomes between men and women. The study demonstrated that women are more likely to present atypical symptoms and are less likely to receive aggressive treatment than men. This disparity has its roots partially in the historical exclusion of women from clinical trials, which has led to a gap in knowledge about how heart disease manifests distinctly in women. The importance of integrating sex as a biological variable in clinical research cannot be overstated. Despite advances, many contemporary studies continue to underrepresent women, particularly in early-phase clinical trials. This underrepresentation can result in clinical guidelines that are less effective for half of the population. Consider the case of a 54-year-old woman named Maria, who presented with what she described as unusual fatigue and slight nausea. Initially, her symptoms were dismissed as signs of menopause or stress. However, a more detailed examination later confirmed that Maria was actually experiencing a mild heart attack. This case is a textbook example of how gender biases in symptom recognition and treatment can lead to poor outcomes for women. The Harvard study used data from over 500,000 participants and found that, despite women comprising over half of the cohort, data analysis often didn't disaggregate by sex. This oversight can mask critical differences in how diseases manifest and respond to treatment across genders. Now, what can be done to address these disparities? First, researchers must ensure gender balance in study recruitment. This involves re-evaluating inclusion criteria that may inadvertently favor one gender over another. For example, many cardiovascular studies have exclusion criteria that disproportionately impact women, like certain age limits or baseline risk profiles. Moreover, it's not just about including women as participants, but also about analyzing and reporting data by sex. This approach can uncover differences in outcomes, side effects, and efficacy of treatments between men and women. By doing so, we can move towards more personalized medicine. We must also consider the role of policy in driving these changes. The NIH has made significant strides with its policy requiring the inclusion of women in NIH-supported research. However, enforcement remains inconsistent. It is crucial for institutions to not only adopt such policies, but also rigorously enforce them. Educational reform is equally critical. Medical curricula need to emphasize the importance of sex and gender in clinical contexts, preparing future healthcare professionals to think critically about these issues. For instance, integrating case studies like Maria's into medical training can highlight the real-world implications of gender disparities in healthcare. Finally, let's talk about the broader implications of gender disparities in research. These disparities extend beyond just clinical outcomes. They also affect our understanding of basic biological processes and disease progression. The underrepresentation of women in basic and clinical research slows our overall progress in medicine. Integrating sex as a biological variable in research is not just about fairness. It's about improving the quality and applicability of our scientific endeavors. It's about ensuring that our medical advances benefit everyone equally. Let's take this knowledge forward and advocate for more inclusive research practices for the betterment of all patients like Maria. Thank you. I encourage any questions or discussions on this topic as we aim to bridge these critical gaps in our scientific and medical communities.